Dr. Fong, let's talk about veneers and lumineers. Well, what's the difference there? You know, you keep seeing advertised on television lumineers, and then you go kind of, is that a veneer? You see, to me, they're all clip-on fingernails. Well, clip-on tooth nails, I guess. But shed some light on us. Tell us about what's the difference and what is, if there is a difference, what are they used for or not used for?
Lumineers and veneers are pretty much the same thing. They are basically like a contact lens that's bonded onto the tooth. So it is made of porcelain. It's like a little porcelain shield that's custom made to fit over your existing tooth. And so veneers, lumineers, they're basically the same. The difference between it is basically the wording or the name of it. Lumineers is a branded type of restoration. Veneers is just a generic name of veneers. So it's kind of like Kleenex. We have Kleenex that's made by that company, or we might have facial tissue that's made by Costco. Okay, but they're the same. We can use that to wipe our face. It's facial tissue. As far as the materials go, they are made of porcelain. There's different types of porcelains out there, but essentially when it comes down to improving your smile by changing either the color of your teeth or improving on the shape of the tooth or to make your smile look brighter, veneers are the most conservative way of improving your smile and giving it a nice smile lift.
And when you say veneers, you now mean veneers or lumineers. Basically, it's literally almost like what that dentist is using. And you shouldn't, as patients, shouldn't concern ourselves too much about which one is which one.
Well, you can.
Okay, go ahead.
You probably should. You probably should, because veneers in the traditional sense has required us to actually remove more tooth structure in order to place a veneer to fit over the tooth. But lumineers, they can be made much thinner.
Got it. You need to grind it down more. And with the lumineers, you don't need to do that at all, or you need to do it less?
We don't need to do as much. It's more minimally invasive compared to the veneers of the past. Because as you had mentioned, with veneers, we used to have to grind off more material in order to place the porcelain facing over it. But that was because of the technology back then, where we required a more thicker porcelain in order to mask the defects or discoloration of the underlying tooth. With the lumineers, we're able to create a much thinner restoration to fit over the tooth, because the porcelain technology of today, which is very innovative, it's much more stronger. Even though it's thin, it also can help mask the underlying color, which in the past before we couldn't.
Got it.
So,
and grinding down the tooth more rather than less is not such a good thing. Why?
Well, if we can preserve as much of your own natural tooth, then that is the best thing for the tooth overall, because it helps to keep and maintain the health of the natural tooth. The more we grind, the more we take away from it, it can lead to weakening of the tooth. So the goal of today's dentistry is to provide minimally invasive dentistry.
Got it. So when would a person have veneers? Like, I can see discolored teeth, like just, and whitening or bleaching just doesn't do the trick. Chipped teeth. What about crooked teeth in front? Like you have a little rabbit teeth there, where in many cases you might want to do orthodontic work for especially young people. But like, just say you're a little older and don't really want to run around with those, wires on it anymore. Would that be, or speed? I'm an impatient person, and if I decide to do something, I'll do it now. I do it full speed. I might crash. I crash often, but it's kind of like, if I crash, I want to know it tomorrow, not in 4 years. Do you know what I mean? And everything I want it now. Very typical Western kind of like, philosophy. Not right, not wrong necessarily, just what it is. So how are veneers used in those areas? Are they?
Yes, that is the most expeditious way of correcting crooked teeth, by using lumineers or veneers. So what was the question? What were we trying to get to again? We're going to have to cut that, by the way.
No. The question here is, what are Lumineers all used for? Give us some examples. Straightening out teeth, getting, avoiding not periodontal or orthodontic work, chipped teeth, and very heavy discolored teeth, or maybe there's some other things, veneers are used for. Give us all the reasons where a veneer can help out. Veneer/Lumineer.
Well, the veneers can help out in correcting misaligned teeth, especially in the front areas of the mouth of your smile. So by removing some of the tooth structure to correct the position of it and then placing a veneer on it will help to improve the smile color, the smile alignment, and so then you would have a much brighter smile to show to others. As far as discoloration of teeth, yes, the veneers can help brighten them up.
Okay, so and straightening it out, the teeth and stuff, and all that stuff. Okay, good. So veneers is a common thing, and they hold for a while. They don't necessarily come off very easy again. Can a person after a veneers in front, which that's where they go, can he bite into an apple? Can he chew on a spare rib, or is that becoming difficult?
You can do that, but we ask that you do be careful with it, because you have to understand that you do now have a restoration that is strong, but it still requires care. You can't just go in there and bite on hard things and expect it to not break, because your own natural teeth can break as well.
Right. Okay. So you want to exert a little bit more carefulness when you have that on it. Okay?
That's right. You want to take care of it like fine jewelry. Yes.
Like fine jewelry. Well, all right. And obviously, it's kind of like the veneers. Is that what some of the, we call them Hollywood smiles, and maybe some of those people have that beautiful smile from nature and it's their own teeth, but apparently, we accuse every good-looking movie star of having had plastic surgery and a full mouth restoration. True or not, beside the point. So, but a veneer can create that wow smile, the right length, the right width, the right just everything, the right color, and just simply look like $1 million. That's what veneers are mainly used for, right? To enhance your mouth, your smile.
It is to enhance your smile. It gives you full confidence too, because if you have a healthy smile, a good-looking smile, it gives you full confidence in yourself, and that will help you in life.
Definitely. Absolutely. All right. Thank you very much again. Bye, Dr. Fong.
Bye.